Okay, clamped. Ogilvy, make the change.
What do they do with all those bottles of fluid? Just dispose of them?
Yeah, I mean...
Can't use them for something?
Hey everybody, and welcome back to the channel as we dive into another episode of our favorite medical drama, The Pitt. I am Dr. Todd, internal medicine doctor. This is...
Allycia, what's up?
We just want to say thank you so much to everybody who's been coming by week after week, checking this out with us. And for all the new people checking us out maybe for the first time, please consider hitting that subscribe button. Help us grow as we dive into this and other medical dramas. Not so much dramas, comedies. We just watched The Scrubs first episode. Hilarious.
You keep calling it The Scrubs.
The Scrubs. Well, it's because I want to say The Pitt.
I know.
The Scrubs. Scrubs without the... So anyway, it's been a whole lot of fun. We hope to keep this going. Give us all of your suggestions, recommendations as we go. Any thoughts before we jump into episode 3? I guess what will be 9 a.m.
No, I just forgot my names, my pictures.
Oh, it's okay. Your name's Allycia.
No.
do we need to do an evaluation?
Oh my God. When we were in high school, I had a shirt that got made at the beach water park when I was little on my birthday. I don't know if anybody knows what the beach water park was.
Probably not.
Okay. Some people probably do.
If you're from Cincinnati.
Yeah. Anyways, it was an airbrush t-shirt and it had my name written on it. And when you went to we were in weight training class together. Is that what it was?
Yeah, it's like gym. Weight training.
And we were not dating, but he used to mess with me all the time. And I did not like to be messed with. So he was like, oh, did you forget your names? That way you had to put it on your shirt. How did we end up together in the long run?
I told you in the episode of Scrubs, I actually majored in rhizology. With a minor in medicine.
Maybe I just had very low standards.
Wow. All right. Well, on that note,
I'm kidding.
Let's jump into this, episode 3. Let's get on it.
Get on.
Get in it. Whatever.
What? No.
Play.
Oh man. Was it the kid that was saying? Was it 2901?
Something like that.
Someone. I don't know if you saw in the comments. Someone said that means.
Yeah, like it's a Pennsylvania code for abduction or something.
Yeah.
So that'd be interesting.
Yeah. 2701.
Is there a medical alert bracelet? You're in a safe place.
You're okay. Trauma 1.
Reasonableness? 27.
2709.
Stop talking to me. Okay. Title 2710.
I think the numbers, did it change?
Did you say 27106?
Oh, get off me. Get off me.
Take the ropes out.
2701.
He said 2701.
2901. Get out. Get out. 2710.
Say
Title
2710.
18, section 1938.
Oh.
Interesting.
He's saying a lot of numbers.
Yeah.
Has he been possessed?
I think it's that kind of show.
Bag of the ointment and non-stick gauze.
Cool. I know the drill. Come back if it starts to ache or stink.
Exactly. Good luck.
Okay, he's got a ponytail on the back of his head that I never realized.
Okay.
It's quite interesting.
Just so the ASO note in your chart. This is Lindsay. We'll bring you back as soon as possible. Stay with her.
At least no, that's thank you.
You need help?
Oh, no, ma'am. I've been on these since 1987. This one here, he got dizzy, fell down.
Forgot my blood pressure
A
medication.
lot of handsome pit crew there.
Ellen knows all the angles, even works the occasional miracle. You think maybe I could have him stop by?
I guess, yeah.
How about a sandwich?
Yeah.
Telling you, there's something about a hospital sandwich.
Yeah, you keep saying that. I don't agree.
Probably meth. Tony Chinchillo, campus security. Yeah, I was at work when this happened, so I'm gonna need everything documented.
Oh man, did he attack him then?
Sounds like it.
I'm Pulse Ox 97. Scott Black's tiny, 5 millimeters, should hold together with Dermabond.
Heard of Dermabond. And Pulse Ox, at least I know all about what that is.
Did she say anything?
No more than she said to you. Nothing going on at home, nothing at school.
I just want to talk about the little girl. I know we've talked about it, that you're curious if it's actually going to be a case of abuse.
Well, I think
Someone in the comments had also mentioned that too.
Yeah, I think, look, I mean, there are a ton of signs here that indicate a high likelihood of abuse.
Yeah.
And given the way that this show has introduced us to some of these more complex social medical issues, I would not be surprised at all if it turned out to be like a truly medical issue, like one of those conditions that causes, say, easy bruising, easy fractures.
There's the first barb out. All right, buddy.
See, Barb, oh, did he climb a fence? Is that what they said?
Yeah.
Not so close so as to stick yourself. I've seen that once or twice.
Pull up at 90 degrees. Harder? Yep, harder.
Oh, it was tased.
Oh, is that what that is?
Yeah.
It's fine. We were going all that fast. The motorcycle ran the light.
I'm Dr. Robbie. This is Dr. Allycia.
Nice to meet you.
And this is Nurse Dana. She's our charge nurse. We need to look over your husband.
I know you guys weren't a level 1 trauma or anything, so you didn't see a lot of this. You did New Orleans more, right?
Yeah, we were.
P60 palp initially started a leader of NS, but lost his pulse.
Who was this motorcycle driver? Looks like he wasn't wearing a helmet. That doesn't make me happy. I'm just.
Oh, gosh, skull with tons of gray matter extravasation. At least it was quick. No helmet?
Nope, because he took the PennDOT motorcycle safety course.
Isn't that what you took, Robbie?
Full compressions, yes, but I still wear a helmet.
Not always.
Is he a donor?
Also, nope.
That is too bad. Hey, Cicely, I think we are done here.
Did he say organ donor? Did he ask?
I think he asked, yeah.
Yeah.
What about a moment of reflection? I thought.
He'll still be dead when we get back.
Well, they're moving on trauma-wise. They have to.
Yeah.
I think they kind of indicated that, like if time allowed. Like.
Well, I think that would have to go without saying. I suppose. But I do appreciate that the med student acknowledged that.
Yeah.
Hand scan with 3D reconstruction of the spine.
He's quadriplegic?
If so, it's a low cervical injury.
C3, 4, and 5 helps you breathe to stay alive.
Yes.
C3, 4, and C3, 5 helps to. Interesting.
Yeah, because it interfaces the diaphragm, which is what's responsible for expansion and contraction.
Okay.
The saying is C3, 4, 5 keeps the diaphragm alive or keeps you breathing and alive.
Okay.
Well, then may I say that one look in your beautiful eyes, and I think I'm falling down.
What a charmer. Just for that, I'm going to get you a foam donut. It's the 8th wonder of the world.
Pretty great laugh you got there, Doc.
Man, everybody's shooting this shot.
Might be a little closer to her age, though.
Yeah.
Williams.
Oh, wow.
Oh, this is the guy who keeps having his
Oh, yeah.
affect.
Affleck.
Yeah, well, 2 more bottles ought to do it. Then we'll drain your tooth and we'll get you out of here before the fireworks tonight. Okay, clamped. Ogilvy, make the change.
What do they do with all those bottles of fluid? Just dispose of them?
Yeah, I mean.
Can't use them for something?
Again, not that kind of show.
Son, you don't know fireworks if you don't know the name Zambelli. He helped Pittsburgh become the firework capital of America.
Pittsburgh's the firework capital of America?
I guess, according to
Stick
Louis.
to doctrine.
Yes, will do.
What's going on with this guy? I'm curious.
This and the little girl are
Yeah.
the ones I'm most interested in.
I know it's a lot to take in.
It's a tumor.
Oh, okay.
It's a brain tumor.
Oh, that makes sense. That's why it was fluctuating.
No, sir, no talking while we do the EKG.
Hanson's all run high, except for Monty. Well, he ran low, but he's dead.
No, quit playing family pharmacist.
Fooling meds is how we've always done it.
Wait, what?
In a big pile in the middle of the table.
Well, look where that got us now.
No, I'm
Slate.
going to jump in here and echo that sharing meds which haven't been prescribed to you is actually a real big no-no.
Yes?
Yeah.
Yes, Langdon.
How are we doing on remembering what your brother might have taken?
We could call back to the house.
Great idea.
So they were just playing with meds?
Scanner can take him now. I'll check the results from upstairs.
Why is he so altered?
Could be concussion, maybe a small intracranial hemorrhage.
All will be revealed by the donut of truth.
The donut of truth. What is that?
CT scan.
Oh.
I like that.
Head CT will show us any brain injury. Neck CT will show us any spinal cord injury. Chest, abdomen, pelvis. We'll rule out any internal bleeding.
Oh my God.
Wouldn't you just do one big MRI?
You use different protocols for different parts of the body. So you don't know. There's no let me just put you on a conveyor belt and go through a scan. Not yet.
Not yet. One day.
I'm sure there will be one day. I think it was on an episode of the Jetsons.
Was it? Or you just making it? Maybe an episode of The Simpsons.
Probably.
And meet here when Mr. Yu's back from CT.
Splitting up so soon?
You're free to see other people, Dr. Rabinovich. I'm looking for cooperation, not commitment.
Okay. Well, that was like a little get along there.
Yeah.
Oh, is this a firecracker burn?
No, sweetie, this is from the full samovar I drop on the floor when this...
Oh. It scared her and she dropped
Yeah.
something. Yeah.
What's a samovar?
It is a big metal urn for coffee or tea. It can get super duper hot. And I was never allowed to touch ours. Ooh, what did you put on this?
The heck is it?
On your burn. Is this honey? The honey is medical grade and the burns are not too bad. Honey actually does have some antibacterial and anti-inflammatory properties. These burns are very deep in some places. They're going to need debridement.
What is debridement?
They have to remove like dead tissue,
Oh, okay.
clean it up.
But figured as much.
Not to worry. We are going to have you patched up.
He said medical grade honey.
Yeah, not just anything.
No. No more fireworks.
I don't know if I quite understood that exchange. It's
I know,
there's
it's a
some,
little interesting.
Well, it's clearly something they inside. Oh, here we go. That's
He's
Dad.
Benny Connors.
Mr. Connors, I'm Dr. Santos. I'm treating Kylie.
She okay?
Could the little girl possibly have leukemia? Or is that not?
Well,
She's bleeding a lot and then
blood,
bruising?
but I don't think her blood work was
Oh.
remarkable.
Okay.
She was running up the stairs.
Gina was chasing me.
We were playing.
As I was saying, Mr. Connors, the laceration's pretty minor.
On the stairs?
What if it's a girlfriend?
Right now is her mother finding out that she got hurt when she's with you.
It was an accident. And before you get all high and mighty, I've got questions of my own.
Like what?
It's giving me chills. Kind of like, I don't know what's going on.
Well, I understand that you and Kylie do a fair amount of roughhousing.
What? I'm sorry, are you kidding me?
Did she just make that up?
Gina, what did you say to them?
Nothing. I said that you're a great dad.
Okay, what else?
That you guys like to wrestle.
Jesus.
Oh, okay. So she said it.
Yeah, that's what I'm asking. Hey, big man, take one fucking step.
Hey,
I
that's
did.
enough. You need to calm down.
If he didn't abuse her,
Well, he's got a temper.
These platelets are only 9,000.
yeah, she's
What
got
is it?
something.
What'd they say?
Her platelets are only 9,000.
Oh, okay. So she's
Do you want
got.
to make your guess before we resume?
Well, so thrombocytopenia, which is low platelet count. And so this is actually a good medical thing to talk about because platelets less than 10,000 can lead to spontaneous bleeding. And so when you're in the hospital and somebody's got low platelets for whatever reason, you track them for that reason, less than 10,000, you would give them platelet transfusions. So then she's got clearly some medical disorder which affects her platelets. So there's things like ITP, which is idiopathic thrombocytopenic purpura. There's TTP, which is thrombotic thrombocytopenic purpura. But anyway, these are different medical conditions that can precipitate in like this. So if her bleeding in her urine, like that could have happened spontaneously due to that. So yeah, this is in fact not a case of abuse, although again, like they kept it close to the chest because then you got the dad getting in like his anger building quickly, right? Like, so they did this pretty well.
It's not what we thought. It's probably ITP.
ITP.
What the hell is ITP?
Something we can treat.
Oh, she was like...
I think she's like questioning herself here, like maybe feeling like I was wrong.
Yeah.
You mentioned that you dropped the samovar when you heard firecrackers.
I keep forgetting that this is the 4th of July.
Yes,
So.
I know.
I was on my way inside, October 27, 2018, to the synagogue when the shooting started.
So they're referencing the synagogue shooting. Yeah.
The police arrived. I felt I had to.
Is that what someone had mentioned?
Someone had mentioned in the comments about this.
4th of July, when kids have their fireworks and firecrackers,
So she's got some PTSD.
Yeah.
And I will come back and we can discuss aftercare instructions.
Yeah, you got it, boss.
Thank you, doctor.
That was sweet.
Yeah.
Those can't be the last words we say to each other, doctor, please.
Good news. CT looks normal. No bleeding inside the skull, C-spine, no fracture C.
It's good, but why is he not waking up?
Well,
Spinal injuries without radiologic abnormalities.
Sometimes it doesn't show up on CT, only on
and
MRI.
CTs are not as sensitive.
Okay.
Are you sure?
They're all.
Okay. Critical potassium level 1.2.
What does that mean?
Very low potassium.
So that can cause paralysis?
Critical injury, we may be looking at
Hypokalemic periodic paralysis.
What is that?
It's a rare condition where potassium gets shifted into the cells, causing profound weakness.
It's not even necessarily had anything to do with the car accident.
I guess not.
Henry Q.
Oh.
You see how
Thank you so much. Did you hear that, Mark? Oh, baby.
This is not a condition that I am familiar with.
It's above your pay grade. I'm just
I
messing.
guess.
What specialty would that be? Neurology, right? No.
No, I mean, it'd be
infectious disease would be Peter.
No, it's potassium.
Oh, okay.
I mean, it is medicine.
And I put beads up my nose.
How many?
We have a story
Oh, we got a
about that.
story. Do you want to write? Do we talk about it later?
Our daughter put a screw in her nose because she thought it was she wanted to have a nose ring. Thought it would look cool, so it went.
Yeah, we can talk about that.
So we'll talk about that.
Got a blue one. Afrin, benzocaine, cas extractor.
Yep. Dad, looks like we gotta go up and get him.
No way, he's sitting.
Afrin's a decongestant nasal spray.
So they're gonna put it in there.
Well, they're gonna use it probably to constrict the blood vessels.
Oh.
That's KCl and saline at 10 MEq per hour.
Oh, so he's awake, just paralyzed.
Yeah.
It's genetic. Why didn't it happen when he was a kid?
It usually starts after the teen years.
And it can be intermittent. Sometimes it's triggered by intense exercise or stress.
Oh.
We've been married 8 years. We've had fights. He's never collapsed.
If his thyroid gets overactive, that brings it on later in life.
Sounds like he's a little dramatic. Just kidding.
So now we just wait.
Bag him. Starting compression, charge at 200. What is happening?
But they said like, oh, he's gonna be okay.
So your little girl was ITP?
Go figure. Nothing like a zebra to kickstart
Isn't
your
that
morning.
like a
It's better than the
a
alternative.
rap? It's ICP.
You're talking about OCP?
OCP. That's what I thought.
Or saying clown
ICP.
posse?
ICP.
Or
Yeah,
ODB,
you know me,
Old Dirty
right?
Bastard? That's ODB.
Yeah, you know me. You know.
Looking good. Taking formula well.
We're here to take a statement. We're looking for a Tony Chincholo.
Yo! Right over here, boys!
Yes. Security guard.
Let me just say, new appreciation for what you guys do every day. Freaking junkie jungle, right?
At the campus library?
Yeah. I don't think that guy's like on drugs. I think there's something else going on. It's too obvious to be drugs.
I guess we'll see. It's certainly on our differential.
Yeah. That's what it is. I was trying to figure out prognosis, diagnosis, differential. That's the differential is the one I was missing.
But even after successful defib.
He came back with one shock. That's as good as it gets.
104/68.
Came back with one shock.
Yeah, they've got his ROSC, return of spontaneous circulation.
Okay.
Can I touch him?
Of course.
Oh God, what the?
We need a gurney.
Nancy.
Does she have it too?
Mrs. Yi?
So this could be
Mrs.
a
Yi.
vagal
Weak
episode.
carotid, shallow
Yeah.
breath.
Didn't that happen to you like when I was giving birth?
Seatbelts. Oh, shit.
Anthony Matawag on the rapid diffuser. Somebody call Garcia.
Shit, we really should have been system examining her.
Okay, I got the head.
Oh yeah.
Any things in the blood that help it clot. And thrombocytopenia is fancy for low platelets, which explains why your skin bruises so easily.
And what causes it?
I was trying to make a joke during that last thing, but
Yeah.
it didn't land.
Didn't land. You could say it fell.
We'll be treating her with high-dose steroids to suppress the immune system and IV immunoglobulin, which reduces the destruction of the platelet.
Yeah. Steroids usually initially IVIG.
Okay. Okay, so when can she get a room in the hospital?
Yeah, I was gonna say.
No, I'm sure I will, but I'll let you go for now. Thank you, Benny.
All right, let's see you when you get here.
See you soon, baby. I love you.
Bye, Mom. Love you too.
Are the girlfriend and they're going to patch up after that little fight.
Yeah, I don't know. That was intense.
It's intense.
To stay put?
I was going to come right back. My backside is killing me. I need to keep moving or I get all achy and stiff.
Well,
Motion is lotion. I say it all the time.
Dr. Hazel Eyes, it says here
Dr.
that it's
Hazel
only
Eyes?
supposed to take an hour
I don't know.
or two for an x-ray.
well,
Oh, the passports.
Prefer live, the dream.
we do we?
Oui.
Oh my gosh.
Des reflets changeants sur la pluie.
Hey, save a dance for me.
Okay.
Oh. She's getting all the love.
Yes. Thank you for coming in. You were listed as his emergency contact.
Yeah, I don't know why. We have been divorced for years.
I've seen her in something before too.
Okay, Leo, can you zoom in and please hold it a little steadier?
Oh my gosh.
A lot of pills. Oh, these are the people who had the M&M party.
Is that what they're called?
That's what I've termed it, when you just throw a bunch of pills in a bowl. I think kids do that, like teenagers steal meds and do.
Oh, that's not good.
Okay, yeah, well, this makes a lot of sense now. Propranolol is a high blood pressure medication. Those are 20 milligrams each.
Okay, so
Propranolol.
slight correction here. Propranolol is a beta blocker, which can affect blood pressure, although it is no longer considered a first-line blood pressure medicine. So you will hardly ever see it used for blood pressure management. It's commonly used in today's world for like migraine prevention or like situational anxiety. So like performance anxiety. So there's patients, if they, let's say, hate public speaking, they can take a propranolol before because it can help kind of relax them. So it can reduce the heart rate, although its blood pressure impact is relatively smaller. Although in some patients who are maybe quite sensitive, it can be bigger.
Yeah.
She said starting dose is 40 milligrams. That's also not.
Didn't she say 20?
She said 40. That's also not actually accurate. Like you have lots of patients on lower doses, particularly those who are using as needed for situational anxiety. 10 milligrams is common, 20. So it's a minor.
Yeah, but that's your bread and butter. You gotta.
Minor disagreement.
Something you.
But
handle a lot, I assume.
Oh, all the time.
Yeah.
But anyway, I still love you, Mel.
How many pills did you take?
Oh, I think 4, maybe 5.
4 or 5.
And that would do it.
Yeah.
Unit 3 and 4 running in. BP 84/56, heart rate 112.
Do you have like a bleed?
Probably. She had like the seatbelt sign.
Mhm.
There's another name for that too, but
20/20 hindsight, she was stable until she wasn't.
Next time I'll use my x-ray vision goggles.
Do an AccuCheck on my DKA patient. Thanks for the backup.
Anytime.
Yeah, that was unnecessary. Really.
I know. Tensions are high though, and
yeah.
How did I lose so much potassium?
You didn't lose it. It got shifted into cells.
Interesting.
She passed out from blood loss. We were able to transfuse her, and she's now on her way to surgery to repair that damage.
This is my fault.
Oh gosh. It's my
they're,
fault.
they're both blaming themselves.
Please don't. Oh my God, please don't let her die.
Oh my gosh.
This is how it works. That everything's so important.
Yeah.
And then you end up here and see.
Yeah, that is how it works.
Yeah.
Unfortunately.
It's a minor enough procedure that most patients go home the next day.
And then?
And then they'll know what it is and how to treat it.
Well, it'll take some time, right, to get the biopsy back.
Yeah.
Kind of surprised.
Well, you didn't have to come.
But I did.
Oh.
I'm really sorry you're going through this, Michael.
Me too. But you know me. I'm a survivor.
Cue Beyonce.
That's in my head.
Not trying to be insensitive. To
Yeah.
add a little levity to the situation.
Yeah.
Because these are extremely difficult conversations.
Blood sugar?
Down from 521 to 436.
Okay. Making some progress.
Were you able to get a hold of your mom?
Yes, she's on her way. She doesn't have a car. She takes buses, so it takes longer. I'm sorry.
Don't be.
Yeah, don't apologize.
Yeah.
Next steps?
Once the glucose is down to 250, reduce the insulin to 0.05 units per kilo per hour.
Because you can normalize the blood sugar before you clear the ketones and you don't get hypo.
You'll have to give IV dextrose to keep the blood glucose in between 150 and 200 while the insulin drip clears the ketones.
Obviously.
Oh my gosh.
I'm sorry, what?
Yeah, thank
Yeah.
you.
Got it.
Duarte, what are you doing in there, son?
Oh, I like that. That makes sense.
Yeah.
Keep him still.
This is a cat's extractor with a tiny balloon at the end. What we're going to do is we're going to slip it past the bead, inflate the balloon, try to pull out the bead.
What?
Pull it out. I've never seen one of these, but it looks pretty cool.
I'm pretty distracted.
Dad's gonna hold your head still, okay?
Look
Can we get one of those for the house?
We might need to.
Oh, the turbinates. You ever hear of John O'Donohue? He's got this book of blessings. And there's this one about fatherhood. Really stuck with me.
I have to read that book.
May you stand sure on your ground and know that every grace you need will unfold before you like all the mornings of your life.
Well, that's profound.
Mm-hmm.
I'd add support your woman and pack good snacks.
Prophetic.
Blue bead out.
Just a couple of dads.
I know. A few dads.
A few dads.
Jackson Davis, talk screen negative for cocaine, amphetamines, marijuana, PCP, benzos, and opioids.
Mm-hmm.
No drugs in his system. Nope.
Nope.
Taser barbs in the back of the victim's neck.
Yep.
Oh, is that what happened?
Changes things, Tony.
Oh, what? I don't know that the taser caused that, but
Oh, that's why he was yelling that.
he tased him in the back of the neck.
Yeah.
I mean, I guess that just dawned on me that yeah, they were
In the back of the neck.
yeah. So he would have been fleeing him.
Yes.
Excellent.
He's gonna be right back. We're gonna numb it up and drain it. 10 minutes tops, okay? Hey,
What's going on, Louis?
I know.
Something's wrong.
field? What field was that?
The number one talking. You got to fix my tooth.
Deal.
I hope that's
I
all
know.
that it is. Trying to think of a complication from the paracentesis. I mean, an immediate complication, a massive fluid shift, I suppose, but
After the shooting, it was the Muslims that came together for us and support him. Anyway.
God, this show just does such a good job of like bringing everything back and
I know.
like, just real world.
Togetherness.
It's not just a medical show.
He's leaving us for 3 months on a motorcycle.
Motorcycle?
With no
You're joking. Why would you do this?
Why? Yeah, we want to know, Robbie.
Man, don't be stupid.
Don't hold back. Tell me how you really feel.
Oh, forgive me for being blunt, Dr. Rabinovich, but how old are you, huh? 50?
Ish.
50-ish year old man on a motorcycle. Very sad.
Very sad.
We all need that mama patient.
I know. Oh, you're gonna apologize.
She stepped away a little bit. Oh no, she just, I guess, shifted.
You ever heard of ITP? I never did.
ICP. Yeah, you.
I really appreciate you bringing her.
I can't remember the letters every time I hear it.
You think I'm some kind of child
No, I
abuser?
never said that.
You didn't.
Oh.
You could be anybody.
Okay, well, I'm sorry for what I said, okay? I was upset and I was worried and I said something stupid and
You think?
you just f***ing let me finish.
You are finished.
They like, or was it oil and vinegar? Is that what they say?
Yeah, or no, oil and water.
Is it?
Those separate.
Doesn't it in vinegar too? I think it's oil and vinegar.
Your oil and vinegar.
That I was wrong. I was so wrong, and I'm sorry about all of it.
That's sweet.
Things were not good at the end. He was a really different person. Huge temper. Not like when we first got married.
Could that have been the tumor?
Could that mass have been there for a while and only recently got worse? Yes.
Yeah.
He was getting into fights with strangers. It's possible.
Oh, she's gonna feel like a horrible
Oh,
person.
this is hard. This is like
Yeah.
really hard news.
Oh man.
It ended your marriage.
Yeah. And you're a horrible person because you left him during sickness and I'm just kidding.
Really?
Would you please leave me as the emergency contact?
Yeah, absolutely.
I was kidding.
Obviously.
Okay.
But this is interesting. This could be like could have been like a whole movie thing.
I know. Just on that one story.
I know.
With burn dressing, but not before she turned my sabbatical into a midlife crisis.
No call that.
Wound check, 2 days.
Got it.
Like Dana smirk.
Yeah.
PTMC charge nurse, go ahead, medic command. Is this a drill?
Uh,
Got it. Thanks.
What's up?
Westbridge has a code black and is closing to internal disaster. Central's diverting all their ambulance traffic to us.
oh.
Code Black.
It could be anything from a flooding toilet to a power outage. How long?
Didn't know. A couple of doctors probably got the holiday flu and they're understaffed.
Sounds like a betting grid to me.
We got season 2's wager.
Oh, I should have left last night.
Yep.
Okay. So I think setting up with likely is going to be the
Oh, the outage, like
Yeah.
okay.
Yeah, like
the hack.
Yeah, the hack. Setting
the
that
preview.
up. So that's actually kind of funny there at the end because they talked about, it could be anything. Could be just a couple docs got sick. There was jokes like that about certain hospitals that would transfer patients to you. Like you would, when I was in the ICU, there was a particular hospital where you really never knew what you were going to get. And so then you'd kind of make similar jokes like, okay, well, it's either a cold or the patient just had a bilateral PE and they're whatever crashing. And you truly never knew until they showed up on your doorstep. So anyway, I think that's seems kind of a universal thing. Sounds like episode 3 in the books. Yeah, I mentioned it so good with the way because it's almost not even a show about medicine anymore. Like when you think about all of the elements that it's just medicine's
human experience.
Yeah, it's just medicine is the vehicle that they've used to share that message. But and probably because medicine is so universal in that it's the place that ultimately all roads lead to in terms of like you could be famous, rich, poor, whatever. Like at the ER, you all come together.
Yeah.
I guess unless you're like uber famous, then I guess you get to bypass all that. But very few people get to do that.
Yeah.
So it's really, really good. Did you have any comments when we
No.
go through the list?
Go through the list.
All right. So here's what we got today. I wrote down difficult conversations. Because I don't know that we really touched on that a whole lot.
Yeah.
Maybe we have some.
I don't think we have a lot.
But
you just said it's hard.
Dr. McKay having that conversation, having to tell this guy he's got a brain mass. These are some of the most difficult conversations, whether it's telling a loved one that you've lost their family member. There's no real script. Like there's maybe a attempted script at how you approach these types of situations.
Which Dr. Robbie tried to do when she said, he said, we're going to do everything I can. He got cut off. Yeah.
Well, yeah, I mean, I'm not necessarily talking about that, but like it's hard not to carry your own biases and judgments into all of these things. And I think that's one of the hardest parts of medicine. And that's something I want to talk about further on the pit stop. I wrote down the CT is the donut of truth, not to talk about it other than I want to make sure I remember that because I'm going to add that into my arsenal. The donut of truth will reveal all.
What's in your arsenal?
Oh, like different sayings or expressions.
You got some that you can pull out or you can't think of any?
Not at the
I'll
moment.
put you on the spot?
Not at the moment. I'll think of them later.
Okay.
I wrote down, not really to talk about it in depth because I actually have never heard of it, but this transient hypokalemic paralysis or low potassium paralysis seems like a congenital thing. I don't know. I've never seen it or heard of it.
I've never heard of it.
But so I wrote down mainly to research that, and I want to see the incidence rates and all that so then low potassium, maybe it's worth talking about, is extremely dangerous. We may have mentioned this before. High potassium's very dangerous. They're both very dangerous. So potassium is one of those really, really critical electrolytes. One thing though they've mentioned a few times is potassium shift. So I don't know if you catch that. Like the issue is
he said something about like migrating to other cells, and all I could think of was like X-Men.
No, so because the guy had mentioned like he used up all of his potassium or wasted his potassium. No, that's not what happens. The potassium shifts intracellularly. So potassium is makes one of the predominant elements or chemicals, if you will, that's in the intracellular space, and it shifts intracellularly. And so the potassium in the bloodstream that we're measuring has then just found a new home. And so that's why the levels come back so low, because it's in its new home. It's not gone from the body. It's just in a space that's not advantageous. And so there are times where we want to shift potassium. So the DKA patient is actually a perfect example of that. They've had shift from in the cells out. So that's actually brilliant. They took 2 cases. Oh, that was intentional. So they took a case where potassium shifted intracellularly, causing low, and then a case where potassium shifted extracellularly, causing
Which one
high.
was the case that shifted extracellularly?
Well, the DKA.
Which one's the DKA?
Diabetic ketoacidosis.
Oh, okay. All right.
So then what they have to do is they have to shift that potassium. In the DKA case, they want to shift the potassium back so they can lower potassium.
So potassium plays a role in diabetes.
Well, it just plays, I mean, it's maybe a consequence of what's happening.
Okay.
More than
of
the cause.
ketoacidosis.
But then,
the other one's a cause.
Well, yeah, the other one's absolutely a cause.
Yeah.
So like certain things can shift potassium, can lower it. So like albuterol, interestingly, can do it. So sometimes you'll see them.
That's a steroid like inhaler?
No, it's inhaler. It's not steroid, but it's a
it's not
beta agonist. So sometimes doing like nebulized albuterol can shift potassium.
Okay.
And so insulin shifts potassium. Drawing a blank on other things. Sometimes there's actually a medicine called K-Exalate, which you can give that binds the potassium. It's probably the truest way to get rid of potassium instead of just shift it.
Why would you give that medicine though?
Well, to bind the potassium so that they can poop it out. But it takes, well, that's what you do.
I don't know why that was funny.
But because you're a toddler. But anyway, we'll do this with high potassium, particularly if it's truly high potassium and not just like an intracellular, extracellular shift. So that's actually a very brilliant thing that this show just did.
It's very brilliant.
It is, actually.
It is.
The bead in the nose.
Exciting.
All right, so I wrote this down because we
Yes.
said we kind of touched on that. Our daughter decided, because she saw somebody on like YouTube who had a nose ring, and she thought, hey, that looks cool, so let me take this screw. And when it wouldn't stay, she's like, well, what if it stayed this way?
Yeah, and then
it
she
went up.
breathed in and it just became a vacuum.
So I was leaving the office and she came to speak to you and she was sneezing a lot. And you're like, you okay? And she goes, yeah, I did put a screw up my nose. How old was she? 5?
4 maybe. I don't even know. How'd she get a screw?
We were doing some like renovation projects.
Oh.
So yeah. And so anyway, so this one freaked out and
You think?
wanted to rush her to the ER. And
Because it was going to keep going.
no, it stopped.
It was going to go into her brain.
I doubt it. But I talked her into, no, I'll be home in a minute. Get my doctor kit, give me some tweezers. One of our friends said just get a real strong magnet.
That was our handyman.
Oh, okay. Yeah, I don't know if I recommend that approach. Would it have worked? Maybe. Might have.
Yeah,
tore through.
because was he there? He was there.
May have damaged some.
Yeah, because we were doing the
Oh,
renovation. Yeah.
Maybe it would
he was
have
there.
damaged some tissues along the way. But anyway, so I came home, got tweezers, basically kind of applied pressure at the bridge of the nose to try to keep it from sucking back up. And
Because you didn't have that little thingy ding.
I didn't have that. That would have been, although there wasn't a whole lot of space around it. So anyway, I was able to extract it and avoid a trip to the ER. And she's alive and well and hasn't stuck anything up her nose since.
Remember, she was thinking about it. Q-tips. She
Oh,
was
yeah.
cleaning her nose out with Q-tips, she told us.
Yeah, which we had to talk about that too.
Yeah, blow your nose.
Anyway, so that was interesting because we've been there, lived it, done that. I wrote this down because, again, this is kind of touching to the emotional elements of the show and how it kind of steps a little bit away from medicine. And that is, I wrote down grudges seem small in the hospital. And so we saw that with that husband-wife both blaming themselves for the other one. We see it with the ex-wife, although that story's got a lot more interesting. But we see it with the ex-wife. I know. But it's just, when things are like this, everything seems small. Like worrying about, I don't know, the most mundane. And I think as doctors, we're hopefully wise to not forget that, because I think sometimes we get turned off to we just get desensitized to all of it. Not maybe for the best, but anyway, I wrote that down because I thought that was a very nice message.
Yeah.
I wrote down the book on blessings from Dr. Langdon. I have to look that up. I want to read that. That sounds profound.
Yeah.
So
a lot of good dad advice in there.
Yeah.
Apparently.
Well, and that was again, like thematically, you had the three dads, right, standing around.
Yeah.
It's like
it's a beautiful scene.
It is.
I mean, it was like, I feel like it was a more simple or not as like crazy wild episode.
No, you still had cardiac arrest, and you still had chest compressions. You still had
but
all
there
the
wasn't
things.
a lot of gore this
There was
time.
less gore, yeah.
Yeah.
Well, and then there's the a little bit of humility there for Santos, but I don't think this should turn her radar off.
Yeah.
Like
I don't think it will.
No, it won't, and it shouldn't. But I guess what it should do is allow for her to be open to the possibilities of other things.
Okay.
And
so
they kept telling her, don't jump to conclusions.
But that doesn't apply there. But it made me think of common sense medicine.
Why?
I don't know. Like of assuming, like ego and then common sense medicine. Assuming you know the diagnosis and you are locked into that.
Yeah.
And with the common sense thing.
Yeah, well, so, I mean, one of the common expressions, and I think I might have mentioned this in a previous episode, but one of the common sayings in the world of radiology is the most commonly misdiagnosis is the second diagnosis. And so meaning like when you circle in on the answer, or at least what you think is the answer, then a lot of times the blinders can come up. And so that is certainly a testament to not close off your curiosity. Just because you think you found the answer. Again, another really good episode. They keep doing it. Like
I know all these themes.
Keep bringing all these themes. So I really want to talk about that, like the bias in medicine and how it might direct some of what we do.
Or you're going to talk about that on the Pitt staff.
Stay tuned, because hopefully we get to record that this weekend, weather permitting. We're expecting a big snowstorm. For those of you living in the Midwest, I'm sure you're.
I think it's like pretty widespread.
Yeah, it's going to affect a lot of people. But we look maybe like a foot of snow. So if we do, Peter might not be able to come over here.
I have to hold it off another week.
So we might have to push it off. Hopefully not. But if we can, then stay tuned for that, because we're going to dive into some of these topics and hopefully share some more insightful stories from us if you're interested. So again, if anybody has stuck around this long, we thank you so much for being here. Definitely give us that like and subscribe. See you next week on another riveting episode of The Pit. See ya.
See ya.
I am Dr. Todd.